International Organization of MS Nurses is pleased to introduce the 10 winners of the 2022 International Nightingale Awards and to showcase their projects that benefit the lives of people with multiple sclerosis. These projects exemplify the caring and creativity prevalent in MS nursing around the world.
IOMSN at its foundation is a group of nurses who want to educate. We want to make sure that other nurses have the tools and the resources they need to provide quality care to patients. One of the chief ways we also really advocate for nurses is that we provide them a safe place to network, to come together and have a community of other nurses who are facing the same challenges they're facing day in, day out in settings where resources are simply not available.
It's vital, it really is, because we learn from each other. For instance, I went to Kuwait a number of years ago, probably about 2 years ago, and many of the nurses took our exam, a certification exam, and we just granted them automatic membership. It's about linking each other, working with each other and learning from each other. And that's the model of the IOMSN.
Let's meet the Nightingale Award recipients.
My name is Shauna Brady. I am a registered nurse at Alberta, Canada. We have a multidisciplinary clinic here that I work in. I am, however, the only nurse here in the program. So I am the only one that gets to interact with the MS patients and help them manage their symptoms of bladder, bowel, and sexual symptoms that they're experiencing. So that sort of inspired me to create some educational videos on managing bladder symptoms, double voiding techniques, to start there, and then we'll see where it takes me.
My name is Shirley McGowan. I'm the nurse educator for the Saskatchewan MS Strength Program. There is an MS clinic in Saskatchewan. It serves approximately half of the MS population of the province. And just to put it into perspective, Saskatchewan has over 250,000 square miles. There is a very significant unmet need. So my hope is to be able to expand the information about my availability, not only to individuals, but to the prescribing neurologists and the family practitioners who look after MS patients, and become a point of contact, a little bit of a lifeline for these people.
My name is Debbie Rebillard, and I'm the clinical nurse specialist for neurological conditions, covering and specialising in Parkinson's, motor neurone and multiple sclerosis. I work and live in a lovely little island called Guernsey, which is in between England and France. I am the only neurological nurse for the island. Coming out of COVID, we've been recognising that hospital services are stretched. There's no one particular place that can meet particularly the needs of our MS clients. So it's a community outreach looking at creating extended links with wellbeing. And so I've got massage therapists waiting to come on board. I've got a private physio who specialises in Pilates. I've got a nutritionist. I've got an expert patient who wants to share her knowledge to everybody.
My name's Nicola Dakin. I'm a multiple sclerosis nurse specialist for Nottingham City Care, and I'm also co-chair of the UK SSMA, which is the UK MS Nurses Association, and I'm also their policy advisor. The main goals really was to support MS nurses in terms of their mental health and well-being, and to reduce stress levels and to reduce the problems that caused to the service in terms of staff sickness and retention. The idea was that if it helped the nurses stay in post and the nurses felt more confident about what they were doing and felt that they could do the job better, then they would be given a better service to the patients.
My name is Miguel Ángel Robles Sánchez. I'm a multiple sclerosis clinical and research nurse at the Multiple Sclerosis Center of Catalonia. This is linked to the Vall d'Hebron Hospital and the Vall d'Hebron Barcelona Hospital campus. I think it's mandatory to try to improve the health literacy level of our population and to try to develop interventions that foster their autonomy and to try to activate our patients. One way to try to reach this aim is to develop interventions where the patients plays a pivotal role in sharing their expertise. We train these individuals to try to foster the leading role and to try to get some skills to respond to questions of the members of the group. As soon as we train and this expert patient, we launch the program.
I am Francesco Pastore, and I'm MS researcher nurse at the MS Center, University of Bari. And I am professor of nursing at the University of Bari, where I teach evidence-based nursing. The standardization of care in multiple sclerosis is fundamental. The nursing intervention using telemedicine are efficient only if treatment and process are standardized. With this project, we want to evaluate the impact of a new nursing care protocol on the quality of life of MS patients comparing with standard nursing care. We engaged 60 patients and we divided these patients in the experimental group and control group. We find that the experimental group have a better quality of life after intervention of nursing care protocol. So it is very important for us to use this nursing care protocol in the clinical practice.
My name is Joelle Massouh, and I'm a clinical nurse specialist specialized in MS. I'm also a clinical manager of the Neurology Institute and the MS Center at Harley Street Medical Center in Abu Dhabi, United Arab Emirates. It really stems from our work every day with multiple sclerosis patients or people living with MS. It comes from questions they ask, especially and primarily in their first year of diagnosis or living with multiple sclerosis. What I'm planning to do is to kind of mimic other popular apps, maybe that match people with similar profiles. Sometimes patients want to discuss a certain symptom, so they could input that information on the app. People can join anonymously with only putting their information like age, gender, whatever information they would like to share. I want to engage people from the community, have them advise us on how to make this work for people living with MS.
My name is Rula Farid Alawiya. I'm working as a multiple sclerosis nurse specialist and coordinator for the MS clinical program in King Fahd Medical City in Saudi Arabia. My project title for this award was Supporting and Empowering the Role of MS Patients Care Partners in Saudi Arabia. I found that care partners keep asking a lot of questions on behalf of the MS patient themselves. And it came to my mind, why I don't ask those caregivers what they need to have support from our side as a healthcare provider and specifically from the MS nurse specialist. The answer has come that they need more education about the disease process and continuous support, and they need to have more about the technical aspects of the care and more current information in new development MS in order to give the best care for their patients. I start with one support group. It's only female and mothers. So they are open and share feelings, talking about what they are doing the best for her daughter or her son. The other mothers start to talk. Also, I get this is new information from this mother. I will apply it.
My name is Belinda Bardsley. I'm the nurse manager of a service called NCRES, which is short for the very long name of Neuroimmunology Clinical Research, Education and Support Service. And there's very little in the literature about the lived experience of participants on clinical trials. So we thought it would be really interesting to see how they're finding that experience and compare that with the patients who go through the normal standard clinic process. We've developed our own survey to hand to our clinical trials participants, which actually directly asks those questions, what did motivate you to participate in this clinical trial? It's often an altruistic thing that drives them to participate. And many of them say it may not help me, but I'd really like to think that it's helping somebody in the future who's in my position. For some, it's about the additional support and vigilance that they get when they're on a clinical trial, because they're being watched a little more closely than you're able to watch them in a standard clinic. For some, it is the hope of having access to a new medication that's not yet approved. But then we really want to analyse this data, publish this data, make it better known across Australia and hopefully globally. If we're all doing things better, it will only result in better clinical trials and better outcomes for our patients.
Hi, I'm Susan Agland, and I'm the transitional nurse practitioner for the Hunter New England Local Health District in Newcastle, Australia, which is about 2 hours north of Sydney. I did a Masters of Nursing Research, and in that I studied the effect of stress management and stress management strategies in MS. Managing MS from my training is holistic. You're not looking after just the person on a drug, but we're managing them as a person. And so they literally come into the door, leave the rest of their world behind for just an hour a week for 6 or so weeks, and then participate in some very basic mindfulness skills. So we'll be doing a meditation and a little bit of mindfulness practice. And then once we've done that for about 20 minutes, then we move into the arts part of it and work on a project together and individually. And at the end of that program, then there'll be an exhibition.
It has been so fun to really see the work that nurses are doing through the Nightingale Awards, seeing that highlighted and watching the creative ways they've come up with providing cares and matching patients with the resources they need, kind of regardless of geographic boundaries. All I can say is I've been inspired by you guys. So thank you so much for what you're doing day in and day out to care for patients with MS.
The IOMSN, I think, models itself after the Nightingale model. And hopefully IOMSN will continue indefinitely until we find a cure for MS.